Hi everyone, Michelle here. On this channel, I document my journey with stage 3 triple negative breast cancer, as well as central adrenal insufficiency and adapting my life to that. That's a side effect of the Keytruda immunotherapy for breast cancer. And it's time for an update. It's been a little over a month. So we are 9 months post chemo, post IV chemo, I should say. So I had 20 weeks at the beginning of my cancer journey of chemo infusions, and I lost my hair. For those of you who haven't seen my hair video, I'll link to that maybe in the description, or you can go back and see. There's one that says my hair. And I've always had long hair my entire life. And so, losing my hair was a big deal. But as you can see, we are 9 months post chemo and it is growing back. I can't do anything with it. It's growing up and out. It's growing faster on the sides. I've got about, 3.5 inches on the sides here and only about 1.5 inches or 2 inches on the top. But, I can talk about ancient alien astronaut theory, because I have Giorgio Tsoukalos's hair now. It goes up and out, and that's it though. It's pretty good. I've got some grays. And actually I colored it once, so but I can't really cut it yet. I don't want to cut it because if I cut it, I'm gonna have to go through this phase again. So that's my hair growth. My last video was an update after my camping trip, where I ended up in the ER because I was having trouble getting a deep breath and my legs were swelling. And so at that ER visit, they did an ultrasound and a CAT scan to rule out any blood clots. They didn't find any blood clots, but they did note something on the CAT scan, which was in this area, that they said was consistent with pneumonia. And that's what I was treated for. And so I just had last week a follow-up CAT scan to see how that has resolved. And there is no notation of anything that looks like pneumonia. So that's good. What this CAT scan did show was changes in this area that are consistent with post-radiation therapy. And so this is the area that I had radiation. You can see there's still just a tiny bit. It's just a different color. I think my skin is just a different color in this area now. It's not burned or anything. It's just a little bit darker right there. That's where the main, probably the darkest spot was during radiation. So my oncologist is thinking that that's probably what they saw in the ER as well, was those those changes that are consistent with radiation as opposed to pneumonia. But nevertheless, I had the treatment, and if there was pneumonia there, it's not there now. The other thing that it noted, which I'm going to mention, because if you are going through this and you are having CAT scans post stage 3 cancer, which is in the primary spot, which is my left breast, and the adjacent lymph nodes, that's stage 3, and you go for a CAT scan and you read the report and it says something like on the lung, they can see a nodule, that kind of can freak you out. And so it did say that this CAT scan said that there was a 3 millimeter nodule in the upper left lobe of my left lung. And so I asked about that. And then I was also comparing, I went back and looked at prior CAT scan reports in my chart. And there was a CAT scan in December of last year, which is when I was in the emergency room with my adrenal crisis, that showed a 2 millimeter nodule on my right lower lobe, so my other lung. So this was something I asked about at my appointment with my oncologist yesterday, and he said, we all have things that come up on these reports, and they may or may not be nothing. It may be anything. It could just be some artifact that is there, and when we recheck it again, it's not. And that is evidenced by the December 3rd CAT scan showing this nodule in my right lung, and this CAT scan last week not showing that, but instead showing a 3 millimeter nodule in my left lung. And that it's called a nodule just because it's in a spot. They can see it. It's not part of the anatomy that they can identify. It doesn't, it's not like a tube, like the tubes that go into the lungs. It's not a vessel. The vessels look different, and he showed me. So there's one thing that just kind of appears in this spot, and then when they go to the next few slides, it disappears again. This is the image, and the circle is the nodule. Everything else is normal. Like 6 months. So I'm going to have another CAT scan in about 6 months to check that, and he said he would feel comfortable saying, or almost guarantee, that that probably won't be there in 6 months. It's just something that comes and goes, like a cyst or something, and they can't, it's not in a spot where they would biopsy it anyway at that size, but he said he is almost certain it's not cancer, it's not metastasized cancer. So if you see, if you have a CAT scan and you see, a nodule on the report, don't freak out, basically, was what the message was from my oncologist. He's not worried, and he said I shouldn't be worried either. So that's that part of it. My CAT scan was good, everything looked good, and in his opinion, we are cleared to continue Xeloda. Now, I was cleared after the MRI. I did have an MRI as well because of some of the side effects I had with the Xeloda, one of them being blurry vision and some headaches. He sent me for an MRI of my brain a few weeks ago, and that came back clear as well. So the only changes noted, or the only things noted in the report on the MRI were changes to the pituitary gland consistent with the damage that Keytruda did, which is what that's where the damage is that's causing the adrenal insufficiency. It's actually on the pituitary gland. Sorry about that. Hopefully my alarm won't go off again and cut my video off. So where was I? The pituitary is but changes that we already knew were there on the MRI, so everything looks good there. Nothing to be concerned about with my optic nerve or anything like that. So I did complete the 3rd cycle of Xeloda. So I started Xeloda, I want to say in May, and it was supposed to be 2 weeks on, 1 week off, 2 weeks on, 1 week off for 6 months. It was supposed to be a total of 8 cycles. That's what standard of care is. And I did the first one, and I had a bunch of side effects, and so they had me take 3 weeks off. And then I did the second cycle of 2 weeks, and I still had a bunch of side effects. So then we decided to go to 1 week on, 1 week off, 1 week on, 1 week off. And so each round of 2 weeks on is a cycle. So I'm taking a week off in between those 2 weeks, but that's the cycle. And so I had, after that second round of 2 weeks on, in that week we decided to go to 1 week on. I had that, so I had 1 week off, and then I had 1 week on, and then the next week was when we went camping, and that's when I had the diagnosis of pneumonia from that emergency room visit. And so I had 5 weeks off because I wanted to be completed with the antibiotics. I wanted to get that MRI. And once that was done, that next week, which was 2 weeks ago now, I did that second week of that 3rd cycle. So next week I will start the next cycle of Xeloda, which will be the 4th cycle, and I'm going to do 1 week on, 1 week off, and we're also reducing my dosage. So the oncologist said, we're doing this as kind of a cleanup. It's just for insurance in case there's anything left over, because I had those 3 positive lymph nodes after surgery. So there's no cancer there that we're monitoring. There's no cancer that they know is there. It's just really like just in case. So he's like, there's no reason that we need to beat my body up over this. And so we're going to reduce the dose. So instead of doing 1,500 milligrams twice a day, I'm going to do 1,000 milligrams in the morning, 1,500 at night. And we're going to try that 1 week on, 1 week off, 1 week on, 1 week off. And that'll be a cycle. And so we'll see how that goes. If I'm still having a bunch of side effects, basically he told me that he's okay with me calling it and saying we don't need to do anymore. And the only reason that I'm really even doing it at this point, I can of course pull the plug at any time. This is my body and it's my choice to continue treatment or not. But I don't want to leave anything on the field. Like I went through all this. I lost my pituitary gland. I did the chemo, lost all my hair. I don't want it to, basically, I don't want it to come back ever. And this is what the oncologist said as well. Like, he doesn't, his goal is that he can tell me that I'm cured and it never comes back and we never have to deal with it again. And that's why we're kind of throwing everything at this. And so we're going to do one more round of Xeloda at least, and then we'll see how I do. If the side effects were not unmanageable last week. I had side effects. I had a little bit of that blurry vision for a few days. I had a headache 1 or 2 days. I have some pretty significant fatigue, joint pain, muscle pain. I'm having the lymphedema, of course, some GI symptoms that come and go, and then skin issues. I have some rash. You can see kind of this, there's a couple of little like spots here where it's not bleeding. It's not like opening up on its own here, but I've scratched it because it was itchy and I gave myself a little sore there. There's nothing else really. We're a week out now. So there's nothing else. It's other than it's just itchy. I minimize that with using products without chemicals. If I use detergent that has chemicals in it and it's not like a super sensitive like newborn skin detergent, then I'll have some rash pop up. My feet and hands, yes, do swell. You can see, maybe, probably not, that little red spot there. That got swollen and irritated last week during the Xeloda, and it hasn't really, it's not irritated anymore, but it's still got that little, like, it looks like a blister there. And so and that is either, it was during Xeloda, so I'm blaming Xeloda, but this is also the hand and arm that I still have lymphedema in. I don't know if you can tell, probably not too much. The difference in, hold on, you can see kind of the structures underneath the skin in this hand, and in this one you can't. It just all kind of inflamed and swollen, and there's fluid retention in this arm from the lymphedema, and I'm going to talk about that in a second. But so it's already inflamed and swollen, and then adding this swelling with the Xeloda, it actually like kind of got raw, and like it started oozing like a fluid, or it wasn't like a slice. Like the last time it was a thin line and it just split apart. This didn't happen this time. It just kind of got that red spot like a blister there. And so that happens on my bottoms of my feet too. I did have a couple of splits in the bottom of my heel, but I was able to manage that with just the same products I used on the Rocasa Skin Soothe, or the magnesium cream. I put that on my feet and it does seem to help. So it was manageable. And so that's why we're going to give it another round. So other than that, updosing my steroids on chemo. And then the other kind of thing to update you on is the lymphedema. And I'm going to do a separate video just on lymphedema. And then I'm going to do another kind of update on supplements. But I'll just talk a little bit about the supplements I'm using now that I also think help with the side effects of chemo. So, and I'll go through what each of these do in a separate video. But just to tell you now, like I was taking modified citrus pectin on the chemo weeks before the chemo. For GI issues, I have L-glutamine powder that I can drink that helps to soothe the whole digestive tract, and it does. I notice that immediately when I use it. Probiotics, I take a woman's probiotic that has like cranberry in it, because another side effect of the Xeloda chemo is that the urine will burn, and it does burn a little bit like when I pee, but it burns the skin like in the perineum area. So that's something that I've noticed as well with the Xeloda. And so I'm taking kind of extra care of like the girl parts there. So a probiotic that is female oriented, that has kind of strains that are specific to yeast growth, just in case there's irritation in that area. I don't want to get a yeast infection. Digestive enzymes and activated charcoal if I have diarrhea. I find that that is much more soothing to diarrhea than taking the prescription Imodium. If I take that prescription strength anti-diarrheal, I'll be constipated. And so then I go swing the other way. And so I find that taking activated charcoal actually helps to soothe the diarrhea and not cause constipation. What else? Zinc carnosine I take. That is a GI, kind of a GI friendly form of zinc. Ester C is vitamin C, and that helps with the skin, which I didn't know. My naturopath told me that. K2 and D3, it's flu season, so it's just good taking. The K2 and D3 are good for cardiac issues, and they're also, D3 is good for immune system. B2, that was the one micronutrient that I was deficient in the last time we tested. So I'm taking in addition to a multivitamin, I'm also taking B2 separately. And one thing I've noticed is if I skip, like I don't take all of these every day, and if I skip a few days of B2, I think I'm more likely to get a headache, because it definitely helps with that. And then that's pretty, like omegas, I'm taking for the menopause symptoms, because part of what chemo shut down is all of my female hormones. So I take a menopause supplement that has Siberian rhubarb, black cohosh, borage oil, DHEA, which I am deficient in because the same area of the pituitary, the pituitary no longer produces ACTH, and DHEA comes from ACTH. So I take a DHEA supplement, but I don't take it every day. Maybe every other day or every third day I will take that, and L-lysine. And then the rest of my supplements that I have, again, I'll go through these in a separate video. I take once in a while, but not on a consistent basis, because they're not really addressing anything that's kind of urgent. And I don't want to take too much, because then, you know, all that has to be processed through the body. Okay. So the other big thing is the lymphedema. And so I have been addressed. It hasn't gotten worse. You can see it's not terrible. It will sometimes, I can't do that. Like I can't make a fist sometimes, because it just hurts, because there's so much inflammation. This week it's doing really well. So things that I've done, I've been seeing a physical therapist and going on a regular basis. They will tape it. So the compression sleeve that I got, if I wear that, it makes me very nauseated. And then I have to updose the steroids, and then that causes more fluid retention. And so it's kind of this vicious circle. So they've advised me to not wear that compression sleeve for now. What I am doing, and they did also, we tried something else, like tubing that goes underneath, like a brace. We tried that, which is much less compression. I still got nauseated, but it wasn't as bad, so I was able to keep it on a little bit longer. And maybe if I only kept it on for a half hour to 45 minutes, then I wouldn't need to take the extra steroids. And so we're still experimenting. Kinesio tape, though, is what they've been doing. And so I will post a picture on the lymphedema video of the way that they tape my hand, just to kind of draw the fluid back. Other than that, at home, just some massage, lymphatic drainage massage. I have had acupuncture. I have had massage and had a professional lymphatic drainage massage, but I can even do that myself and do some dry brushing. Physical therapy, this week we used the cold laser on it. And so, and then the Rocasa lymphatic cream, lymphatic lotion is what I have, not cream. It's a little less greasy. And all of that does seem to just it's not getting worse. It does improve every once in a while. If I eat something particularly inflammatory, maybe it swells up. If I'm out in the heat, it will swell up, but otherwise it's doing pretty well. And yeah, I'll do a video just on that. But other than that, there's nothing exciting to say. So our next steps are, we're going to try this reduced dose of Xeloda, 1 week on, 1 week off, 1 week on, 1 week off. That's the next cycle, and we kind of reassess as we go. And then I will have a breast MRI before my surgery. I will have my second surgery at the end of October. And so the second surgery is a breast reduction on the other side. So they call it reconstruction so that they match. But the MRI is going to just make sure that there is no cancer in that breast still, because there wasn't before. And so my breast surgeon wants to just make sure that there is nothing there that they need to plan for ahead of time. If it is just a simple breast reconstruction, then that surgery should be actually done on an outpatient basis. I did really well last time, and so they're confident if I do the same protocol with the updosing the steroids before surgery, getting the IV stress dose during surgery, and updosing for the next several days, or stress dosing for the next several days with oral steroids, as long as I can keep it down, I can go home the same day. So looking forward to that and not being lopsided anymore. Have a great weekend. It's also a Friday. So see you soon. Like, share, subscribe, comment, ask me questions, or leave your own comments, and we will see you soon. I hope to not go this long in between updates again. Thanks.